Hello, fellow Pops. I'm Dr. F Scott Feil, and I'm bringing you a message from our sponsor at Ice Shaker. My diet's always been a little bit messed up most of my life, and I recently started trying to take back control of my health. And one of the issues my doctor pointed out was that I needed to make an increase in my protein intake. Now, I can't eat chicken breasts all day, every day, so protein shakes and powders have become a big help. Ice Shaker and its built in removable agitator is an amazing product. They come in a bunch of sizes and colors, and you can even get inscriptions and logos on them. They're stainless steel, double wall insulated, and hold ice for 30 plus hours. If you're interested in purchasing one, you can click on the link in our show notes. Or if you're interested in selling them for your business and making commission, and let's be honest, if you're listening to the Professors of Profit vlogcast and you can consider yourself a pop or a professor of profit, you're likely interested in selling these as a side hustle. You can click on that link in the show notes as well. Or you can reach out to me directly on social media. I'm pretty available there. I love Ice Shaker, and I'm betting you, your patients, and your clients will too. Ice Shaker, let's shake things up. Now let's start the show. Hello, everybody, and welcome to another episode of the Professors of Profit vlogcast. I'm your host, Dr. F Scott Feil, and I've got with me today a longtime friend, good catching up, Bert De Vera, physical therapist and business owner. Bert, how the heck are you, man? Tell us a little bit about your journey and what you've been up to and how it kind of led you into this business world you're in.
Thanks, man. Thanks for having me. Scott, it's been a long time since we saw each other. I believe the last time was in Florida.
Yeah, pre-COVID.
In one of the conferences over there. So thanks for having me on your podcast. Guys, my name is Bert. I'm a physical therapist, and I've been a PT since 1998. So this is my 24th year as a clinician. And I started my business in 2003. So I was an employee from 1998 to 2003, like everybody else. You know, I was a traveling physical therapist working 13-week contracts. So that was my background as far as being an employee. And then I'm sure you're probably going to ask, okay, when did you start your business, right? So I pulled the trigger in starting my own business in 2003. And I just want to share a quick story why and what was the light bulb in, with me starting that business. So back in 2003, my wife and I were pregnant with our second child, and we have a 3-year-old daughter. And that was a time where the company I was working for, the home health agency I was working for, couldn't find a PT to replace me. They made me work 21 days straight, including Sundays. That's straight. So, I couldn't complain because I was a newbie, right? And we needed the money. My wife was pregnant and, got a child. So we're having our second child. So that was the last straw as far as, my career as a physical therapist working for someone. So on my third week, I would go home hungry, tired, ton of paperwork. And of course, my wife was waiting for me. And of course, she was waiting for, an adult conversation, just being with our daughter the whole day. And she prepared food and all that. And here I am. I went home, tired, hungry with all the paperwork. I couldn't give her the adult conversation she wanted because I'm rushing to finish everything for the next day. I couldn't even play with our daughter. So we ended up fighting. We were fighting. Man, I'm telling you, I felt like a horrible husband, a horrible father, and a horrible provider because that was not the American dream that we wanted. All right. So we finally sat down and we spoke about it. I said, look, something's got to give. We got to change, how we're doing this. This is not, the direction I want us to go. So with my wife's blessing, which is very important, as a couple, if you're married, you got to be on the same page, right? So I asked my wife, look, if you give me permission, I want to start my own business. And if it doesn't work out, 6 months or so, then I can always look for a job. I still have my license, right? So at that time, we have about, I'd say, 3 to 6 months savings. So we had some little cushion. So she gave me her, blessings. Basically, go ahead, try it, see what happens. And that was it. The rest is history, okay? However, it wasn't that easy because at the time I was thinking, okay, the business I'm going to do is outpatient clinic, start a brick and mortar, hire people and all that. And when I realized what that entails as far as money and time and risk, man, I backed out. I can't do an outpatient. That's going to cost a lot of money, you know? So I did my research, and then I found out about this model, which is home health contracting, which I'm going to talk to you guys about today. How do you contract with home health agencies, and how do you make money? So that was the start of my journey, but we can get into the details of how I made money later on, maybe. So
Yeah, man. I mean, so we haven't talked about home health agencies at all yet on the podcast. So I'm excited, to kind of dive into this. But, why is that a model? Like, why is home health agency something that maybe professors or new clinicians or people wanting to start a side business, why is that something they should look into? What are the pros and cons to that? What does it look like?
Good question. So home health agencies are usually the front line of healthcare after a patient gets discharged from the hospital. Okay. It used to be where when patients get discharged from the hospital, they go straight to the nursing home, right? But nowadays, the government is trying to save money. Imagine if they can skip going to the nursing home and sending home health right away to the patient's home. How much savings is the government, going to have if there's no expense on SNF, right? So they came up with what we call PDGM, patient-driven groupings model, to where there's a budget for the patient. For example, you have a total knee, total hip, or whatever diagnosis that is. They allot a certain budget for that. And that budget now is going to be budgeted by the hospitals and the home health agencies. And whatever is left is the profit. Okay. So that's why home health agencies are very crucial in the healthcare industry. And they're actually the highest paid sector of healthcare providers compared to outpatient, compared to SNF. Home health is the highest paid. Okay. As far as I know. Okay. And so with that, there's a huge need for therapists to service those patients at home. Okay. Although not a lot of therapists want to do home health. There's no gray area, as we say in the home health, industry. It's either you like it or you don't, right? But unless you try it, you wouldn't know it. Okay. If you just listen to some opinions and they tell you, hey, don't do home health, you won't learn anything, you're on your own, it's risky and all that. Man, I've been doing this since 2003. Those are not true. Okay. In the home health setting, before they send home the patient was already screened at the hospital. If it's a hostile environment, they won't even send you there. Okay. If there's any issues or danger, they won't send you there. Okay. Number two, if they say, oh, you won't learn anything, let me ask you this. Did the patient's diagnosis change because they went home? No. Will your skill as a therapist change because the patient is home? No. You would treat the total knee, total hip, or whatever diagnosis there is the same, regardless where the patient is, right? So the thought that you won't learn anything is not true. Matter of fact, you'll be forced to learn more because now you're on your own, right? So you got to do your research. You got to call your peers. Hey, I have this case. What do you do with this? Blah, 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 blah. I've never seen this before. Or what do you think is the current evidence-based treatment on this? Blah, blah, blah. You do the job as a clinician to get this patient better, right? To improve their quality of life. So that's why home health is really something to look into, because the number one thing also about the beauty of home health is when a patient goes home, guess what? Their guards are down. They're very cooperative compared to a person or a patient in SNF. What do you hear a patient say when they're in the hospital or they're in SNF? I wanna go home. Exactly. So this is why home health is important.
Yeah,
Did I answer the question?
Yeah, absolutely. I did home health for many years. I did it right out of school. I traveled and did traveling contracts. So I did a SNF, then I did 2 home health contracts, one out in Hawaii, one in Nashville. and I didn't know anything about home health, right? And you are on your own little island a little bit, right? They train you at the front end, but then you're out on your own, right? And as long as you're confident in your skills, I don't see any reason why a new grad couldn't do home health right out of the gate. Like you said, the money's good. The scheduling is great. You have flexibility in your schedule, so you can see a bunch of patients on one day and not as many patients on the next day. I can't tell you how many times I worked like a 8 to 7 or something like that. Then the next day went in from like 8 to 10, then played golf for the rest of the day while I was out in Hawaii. Right?
That
Like
sounded good.
yeah, man, I loved it. It was awesome. It was great. I loved the being in the home, like you said, they let their guard down. They're just more comfortable there. I feel like they
Right.
heal better when they're at home, right?
Right.
It's like it's their home, it's their comfort zone. So you're coming in there. Now, I will say there are some, definitely hills and things you have to navigate, but it's just finding what they have in the home and working with them on that.
Right.
It's adapting, and I think physical therapists are very good at that. So
Yeah.
tell me a little bit about then what the home agency model looks like then. If somebody's going to start that business, what does that look like?
Okay. So, guys, if you're listening right now, this is the time you get your paper and pen, because I'm about to discuss with you how I make money as a company doing home health contract. Okay. Just like the Jerry Maguire show me the money, right? So, all right. So this is how you make money doing contract with home health. Imagine a staffing company, just like a travel agency, right? The travel agency sends us 13-week contracts, right? And then they make money. Their spread is they charge whatever facility it is a certain amount, and then they pay the therapist a certain amount, and then they make the profit. Okay. So the same thing with home health contracting. All right. Let's do a case study. So I saw a patient on a Friday. It was a total knee, and the frequency was 1 week 1, 3 week 4. So you have 13 visits. Okay. 1 week 1, 3 week 4. Okay. I hope you guys follow that so far. So with 13 visits, I did the PT eval, and I did the 13th visit, which is the PT discharge, right? So here in Texas, the average rate is about $75 per visit. It can go as high as 85, can go as high as 90, especially now that we have inflation, right? But let's just say 75, okay? So $75 per visit for 13 visits, okay? So if I did the eval, that's 75. I did the discharge, that's another 75. So I made 150 so far, okay? So 2 visits out of the 13 visits, you have remaining, 11 visits. The 11 visits in between, I send my PTA, okay? I pay my PTA $45, okay? $75 is what I charge to the agency. I pay my PTA $45, so there's a profit, or what we call a spread, of $30. So $30 per PTA visit, that times 11, you have a profit of $330. So $330 profit plus my 150, okay? So I made $480 on that one case, and the time that I spent was probably about an hour, 30 minutes eval, 30 minutes discharge. Who gets paid $480 an hour as a therapist? No one, right? Now, should I decide to play golf like Scott, maybe, and I want to hire someone to do the eval and discharge, I will pay that PT the 75. I would break even on that eval. I would break even on the discharge. But guess who keeps the profit? I do, because it's my company. I will keep the $330 from the PTA profit, okay? Now, the PTA is happy because I provided jobs, right? And what happens when a PTA is not that busy in the nursing home, in the SNF? They send them home, right? Or they make them use their PTO, which is not good. You want to save that PTO for your vacation. So guys, we are solving a problem. We are bridging that gap when our colleagues, our PTAs or PTs are not that busy in their full-time jobs, and we're providing a job. So don't look at this as if, oh, Bert is taking advantage of a PTA. No, I'm paying them way above the market rate, right? So I'm providing a job. So it's a win-win. It's a win-win for them. It's a win-win for me. I make a profit. So that's how we make money. Now, that's just one case. Imagine if you have 10 cases of that in a month at 300, let's say $300 profit times 10 patients in a month, which is very, very low. That's $3,000 profit. Imagine if you can apply that $3,000 towards your debt, your student debt. How will that change your life when it comes to your finances?
Yeah, that's massive. Again, I think the big thing there is you're leveraging time, right? You're leveraging other people to do some of the work to get back some of your time, and making money, which is perfect because you need the money freedom of things to have the time freedom of things, which is, I think, the ultimate goal for a lot of people is to get that time freedom.
Yes.
But yeah, the more you can leverage other people, and like you said, create jobs, but also, paying a good fee as well. So it's a win-win. Well, Bert, tell us a little bit then about some of the tips, tricks, and pointers that you can give. You've been doing this for quite some time now. If somebody's looking to start a home health agency type business, what are some tips and tricks and pointers you can give to the audience?
Sure. I just want to make a quick clarification. So my business model is a home health agency contracting. Okay. So I'm not the home health agency per se. So the home health agency is a company that's certified by Medicare. They are part of the insurance network. They are the recipient of the referral from the hospitals or from the doctors. So they're a separate entity. We are the contracting company.
Right, you're filling the gaps, the voids
Exactly.
that they need for staffing, essentially. You're providing the staff to go out and do the evals and the treatments and stuff.
Exactly. So we are the rehab department, basically. So our big difference with traveling agencies is we don't require a 13-week contract. So that's our advantage. So whenever we go out there and market to the home health agencies, we tell them, look, unlike travel agencies, we see your patients as they come in. As you said,
it's not going to be a turnover. We're not going to lose people. We're going to be there.
Exactly. So this is how it works. I want to discuss with you the pros and cons of this business, if that's okay, because for any business venture that you tackle, there's always pros and cons. If someone comes to you and tells you, "Hey, start this business. It's foolproof. There's no cons. It's all pros." Start running. So that's not true. There's always pros and cons in any business. All right. So you got to know what you're getting into. So there are 3 pros and there are 3 cons in this business. So let's start with the 3 pros of this business. Number 1, you don't need Medicare certification or credentialing. You don't need to be a part of any insurance network. Okay. The barrier for entry is very, very low. Okay. So one of the tips is if you start your own company, and basically this is just from 30,000 feet view, because there's more to this than what really happens. But just the basic, you got to have your own company, you got to have your own crew, and basically when you get a contract, they send you a contract, and you see the patients, and you build the agency. Okay, so going back, number 1, you don't need Medicare certification. The home health agency does, but your team does not. Okay. Number 2 pro of this business is you don't market to doctors. Okay. So unlike outpatient, clinics where they get their patients directly from the doctor, with this, you get the patients directly from the home health agency. So who does the marketing to the doctors and the hospitals? The home health agency. So that's out the window. Okay. They pay a marketer to get patients for them. Now you might ask, okay, Bert, why would they do the marketing and then give you the patients? Because they get a piece of the pie. Okay, let me give you an example. Let's say the budget for a total knee is $5,000, and the doctor ordered 3 times a week for 4 weeks. Typical, right? So let's say the 12 visits cost $75 a visit. At 12 visits, you're looking at how much? $750 at 10. $900, right? So $900, the budget was $5,000. Let's say they sent out the nurse for $400. few visits from the nurse. So 900 plus 400 from the nurse, they're out 1,300. But the budget is $5,000, for example. So $5,000 minus 1,300, the home health agency is making what? 3,700? And all they did was outsource the rehab to me and my company, sent the nurse. They'll do this all day. Okay, it's a very good model. Okay, now you might ask, okay, Bert, why don't you just start your own home health agency then? Okay, it's a different ball game. It's a different entity. Okay, they take the risk of getting surveyed, having a medical director, and getting audited and all that stuff. And for you to even start, you'll have to have at least 1 year of 10 to 12 patients pro bono before you can even apply for a survey. So is that something I want to do? My answer is no. It's just my choice of not wanting to go that route. I just want to concentrate on the rehab, bill for our services. I'm happy, they're happy, everybody's happy. All right. So, and the third pro of this business is you don't have to hire full-time employees. The biggest expense, guys, in any physical therapy business is your staff. I don't care what model you have. Your staff is your highest expense. Okay, whether it's cash based, whether it's outpatient, whatever it is, you got to pay the therapist, right? Now, I used to have full-time employees. I used to have salaried employees. And I'm telling you, Scott, when I was first starting this business, I couldn't sleep when it comes payroll time. You know why? Because if we don't have enough patients coming in, I still have to pay them their salary. And I learned from that. I'm like, you know what? I don't want this. I don't want this stress. So I switched from full-time to PRN. And the beauty of having just PRN therapists is you pay as you go. You only pay them when they bring in revenue, meaning when they saw a patient, you pay them. Okay. And worst case scenario, let's say I hire you, Scott, to do an eval for me, and you come back and you tell me, hey, Bert, this patient is not homebound, or this patient is high level, they don't need further visits. Am I going to lose money? No, because I still bill for your eval. And when I bill for that eval, I just pay that money to you. I break even. So what's the worst case scenario? Worst case scenario is I break even. I don't lose money. Okay. And there's two rules in doing business as far as Warren Buffett is concerned, right? Remember these two rules. Rule number one, don't ever lose money. What's rule number two? Don't forget rule number one. Right? so
easy. So easy.
Yeah. So that's why I love this model. Now, before I discuss the cons, do you have any further questions, Scott?
No, man, no. Keep rolling. I love it.
Okay. So there are three cons of this business. And guys, listen carefully, because if you don't know these cons, you might dive into this and think, oh, crap, I didn't expect this, right? So I'm going to tell you now, this is based from my experience, because I almost quit. Doing this business in my first 3 years of doing this business. And there's a saying in the business world, most businesses fail in the first 3 to 5 years. And I tell you why. Because that's your period when you do your trial and error. You're trying to figure out things. And when you can't figure it out, or you find something that causes a snag in your business, you're out. You fold, right? So the first con of this business is this business cannot work for you if you don't know how to negotiate. Okay, negotiation is key. You might get a contract and you think, oh, I got a contract now, I got a business. But if it's not a good contract, you can lose money, right? And home health agencies are very, very good in negotiation. They will try to lowball you as much as possible. Okay, if they can, for example, if they will ask you if you would do a visit for $60 instead of $75. It's hard to make a profit on a $60 and you pay your PTA $45. I wouldn't. Okay. So this is where I come in. I teach my mentees how to negotiate. Okay. I've been doing this since 2003. What are we now? 2022. It's almost 20 years of doing this business. I know the questions they're going to ask. I know how they're going to negotiate with you. So I teach my mentees how to do that. Okay. We do a role play. I pretend to be the agencies and I bombard my mentees questions. Okay. Pitch me your company and I'll just attack you with questions. I want to hear your answers. If I don't like your answer, for example, Scott, let's say I'm mentoring you. If I don't like your answer, I'm going to tell you, okay, Scott, this is not how you answer that. This is what you need to do. Okay. And then when D-Day comes, they go to the agency and they do the actual negotiation and they throw them a number. I teach them how to either accept or counter. So they come back to me and they tell me, hey, Bert, this agency offered this fee per visit. Do I accept it or do I not? Okay. We discuss it. We brainstorm. And then at the end of the day, I tell them to make the final decision because it's their company. Okay. It's like, what would Bert do in that kind of situation? All right. So negotiation is key. Okay. That's one of the values I bring in my mentorship program. I teach you how to negotiate. Okay. Number two con of this business. This business cannot work for someone if they don't know the right people to hire. Okay. You and I know, Scott, that there's good and bad therapists out there. You agree?
Yeah, absolutely.
Yeah. So it only takes one bad therapist to destroy your business. Not because they have a license, you're going to hire them. Okay. If you hire a therapist that you haven't vetted, you hire a therapist that you didn't know was a druggie, stealing pain meds, you're done. Okay. You hired a therapist that stayed with the patient for 5 minutes and then told you, hey, I did this, did that. And then the patient complained, called the agency, you're done. That's the end of your business. Okay. So it's important that you have the right people in the bus. How do you screen therapists, quality, excellent therapists that will work with you and work for you and your team? I teach that. Okay. I have a set of interviews that my mentees can download and they ask those questions. And then again, they can come back to me and brainstorm. Hey, Bert, I have this PTA asking this much money. They're saying this is their experience. How many years experience? Will I hire this person or not? Do I give them the amount they're asking or not? We brainstorm. And then I will tell them again if I will hire that person or not. Okay. So that's the power of mentorship. I give them my 19 years, almost 20 years of experience of doing this. And I'm basically cloning my business and my process to them. All right. Because I tell them, look, if I'm doing this already for 19 to 20 years, that tells you I'm at least 4 times the threshold of businesses that fold. Okay. And I'm saying that not to brag. I'm just saying that as a proof that I must be doing something right for doing this for 19 to 20 years now. Right. Yeah. So, and then the third thing, the very, very important thing, the third reason why this cannot work for someone. This is important, guys. Write this down if you're listening. This cannot work for you if you don't know how to get your money. This is the number one reason contractors fold, when they don't get paid. Okay. And this is the reason why I almost folded in my first 3 years of doing this. There was an agency that owed me $22,500. $22,500. That's a lot of money. After using a lawyer, I only got $5,000 back. Okay. I was at the verge of folding. You know, I thought to myself, you know what, the heck with this. I'm just going to go look for another job. I don't have the energy to put up with this. $22,500. That's a lot of money. I only got $5,000 back. But I did not. Okay. I told myself, you know what, this is the highest tuition fee I'm going to pay for this lesson. This is not going to happen again. All right. And so it never happened again. And I teach my mentees how to avoid that. How do you avoid getting in that hole? How do you know if a home health agency is a keeper? Okay. What are the signs when you need to stop taking referrals? What do you do when they're late on their first payment? How do you approach that? Do you call them? Do you write them? Okay. And how do you avoid getting to a point where you need a lawyer? Okay. Where you can, present your case in the local municipality and you will win 99% of the time because you have the proof, you have the contract. How do you do that? Okay. So I teach all of that. That way you stay in business. Now, if you don't follow that and you keep doing what you want to do, not following the system, then that's on you. That's not on me, because I'm already telling you, I've experienced this before. You cannot let an agency not pay you at a certain time frame. If you do that, you're gonna go, into the hole. Okay, so those are the pros and cons, and I hope that really helped you guys. Now, just to kind of recap everything, I'll give you the quick recap of what you need to do, from the top in home health contracting. Number one, you got to have a company. Number two, you got to have your crew. Number three, you got to have your contract. Okay. Number four, you got to have the right documentation. Okay. And number five, you got to know how to bill. Those are the top five major moving parts of this business.
Yeah, no, I love it, man. That's a great insight, and I hope people took a lot from this episode. I think there'll be a lot of active learning done here, so I appreciate that, Bert. But where can people reach out to you and kind of follow up with you if they have more questions or just want to see what you're up to these days?
Yeah, so you guys can check out the free videos on how this business works. You can check out homehealthcontract.com. That's easy to remember, homehealthcontract.com. Or if you want to see further videos of our colleagues who did this business under my mentorship, you can also go to rehabpreneur.com, or you can put bertpt.com. It takes you to the same website. That's B as in boy, ER, T as in tango, PT as in physical therapy, bertpt.com, and you will find free videos in there. And I'll probably be only one of your guests, Scott, that'll give his phone number out. So I'll give you guys my phone number. Feel free to text me. My number is 972-649-9909. Just text me, hey, Bert, wanted to learn more about you, where to start, blah, blah, blah. Again, that's 972-649-9909.
Awesome, man. I appreciate that. We'll put all those links in the show notes so it's easy for people to find you. Bert, always a pleasure, man. I enjoy catching up.
Thanks, man. I appreciate that. And if I can just add one more thing.
Yeah.
Guys, there's no perfect business model. I've always been asked, okay, Bert, what's the best business model? Okay. The best business model is the one you're willing to put up with. Okay. Because any business model, you have to put in the time, the energy to make it happen. Okay. I always ask anyone who want to talk to me first, these two things. I always ask them, do you want to be a worker or you want to be a business owner? There's no wrong answer, okay? It's just a matter of choice. If you want to be a worker, that's totally okay. I'm not your guy though, okay? I'm not going to teach you how to climb the corporate ladder. But if you want to be a business owner, make a profit, then I'm your guy, okay? And then they ask me, well, Bert, I have a business, right? Because I already got an LLC. No. Even a high school kid can do an LLC. That doesn't mean they have a business, okay? The true test of a business is this. Ask yourself, am I making money if I stop working? If the answer is no, and the business is dependent on you, you don't have a business, you have a job, okay? But if you can make money, which means you're leveraging staff or your business model, if you can make money even if you don't work, then you have a business. That's a true test of a business. So I hope you guys learn from that.
Yeah, I love it, man. And, like I said, not everybody's cut out to be a business owner or an entrepreneur, and that's totally fine. There's nothing wrong with that. Yeah. But I do think that, you've got to find the business model that works for you and your lifestyle. And that's going to be different for everybody. So,
Exactly.
it is a lot of self-reflection and a lot of figuring out what's going to work for you. And, a new grad unattached with nothing, to worry about is going to be way different than, say, a 40-year-old with a wife and kids and, plans to retire in the near future. It's like different strokes for different folks, but there's, a bunch of different ways to accomplish a successful business. It's just like you said, it's a lot about learning, what's going to work for you. So
that's right. That's right.
Well, cool, awesome, man. Yeah, it's been a pleasure chatting, and look forward to catching up with you again soon, man.
Yeah, man. Hey, I didn't know you're a golfer. So if you want to play golf in San Antonio, let me know. I've been playing there at the Quarry, actually. So,
oh, nice. I've heard good things about that course. Can't wait to check it out.
All right, man. Well, Scott, thanks for having me. Appreciate you, man.
Absolutely.